Breast health is a topic of significant concern for many individuals, particularly women, as the breast tissue is susceptible to a variety of conditions throughout life. While the fear of breast cancer often dominates conversations about breast issues, it is important to recognize that most breast changes are benign, meaning they are not cancerous. Understanding common breast conditions such as cysts, fibroadenomas, and other non-cancerous disorders can help alleviate anxiety, promote early detection, and encourage appropriate medical care. One of the most frequently encountered benign breast conditions is the breast cyst. Cysts are fluid-filled sacs that develop within the breast tissue and can vary in size from microscopic to several centimeters in diameter. They are most common in women between the ages of 35 and 50, particularly those approaching menopause. Hormonal fluctuations during the menstrual cycle can cause cysts to enlarge and become tender, often resulting in a feeling of fullness or discomfort. On examination, a cyst may feel like a soft or firm lump that moves easily under the skin. While cysts can sometimes be painful, they are typically harmless and do not increase the risk of breast cancer. Diagnosis is usually confirmed through ultrasound, which distinguishes cysts from solid masses, and in some cases, a fine needle aspiration may be performed to drain the fluid and relieve symptoms. Most cysts resolve on their own, or with minimal intervention, though persistent or recurrent cysts may require further evaluation. Another common benign breast condition is the fibroadenoma, a solid, non-cancerous tumor composed of glandular and fibrous breast tissue. Fibroadenomas are most prevalent in women under 35 and are often discovered incidentally during a routine breast exam or imaging study. They typically present as smooth, round, rubbery lumps that move easily within the breast and are usually painless. The exact cause of fibroadenomas is not fully understood, but hormonal factors are believed to play a role in their development and growth. Unlike cysts, fibroadenomas do not fluctuate with the menstrual cycle, and while they are benign, some women may choose to have them removed if they are large, growing, or causing discomfort. Diagnosis is generally made through clinical examination, ultrasound, and sometimes a core needle biopsy to confirm the nature of the lump. In most cases, fibroadenomas do not increase the risk of breast cancer, and many remain stable or even shrink over time. Fibrocystic breast changes represent another extremely common condition, affecting up to half of all women at some point in their lives. This term refers to a spectrum of benign alterations in the breast tissue, including lumpiness, tenderness, and thickening, particularly in the upper outer areas of the breasts. These changes are closely linked to hormonal cycles and are most pronounced in women of reproductive age. Symptoms often worsen in the days leading up to menstruation and subside afterward. While fibrocystic changes can make the breasts feel dense or nodular, they are not considered a disease but rather a normal variation of breast tissue. However, because these changes can make it more difficult to detect new lumps or abnormalities, regular self-examination and routine screening are important for ongoing breast health. Mastitis is another breast condition that, while less common than cysts or fibroadenomas, can cause significant discomfort. Mastitis is an infection of the breast tissue that typically affects breastfeeding women, although it can occur at other times. It is characterized by redness, swelling, warmth, and pain in the affected area, often accompanied by fever and malaise. The infection usually arises when bacteria enter the breast through a cracked or sore nipple, leading to inflammation and sometimes the formation of an abscess. Prompt treatment with antibiotics is essential to resolve the infection and prevent complications. In cases where an abscess develops, drainage may be necessary. Mastitis is generally not associated with an increased risk of breast cancer, but persistent or recurrent infections warrant further investigation. Breast pain, or mastalgia, is a frequent complaint and is usually benign in nature. It can be cyclical, related to hormonal changes during the menstrual cycle, or non-cyclical, unrelated to hormones. Cyclical mastalgia often presents as a dull, heavy ache that affects both breasts and is most intense before menstruation. Non-cyclical pain may be localized to one area and can be caused by trauma, infection, or musculoskeletal issues. While breast pain is rarely a sign of cancer, any persistent, severe, or unusual pain should be evaluated by a healthcare provider to rule out underlying problems. Intraductal papillomas are small, wart-like growths that develop within the milk ducts of the breast. They are most common in women aged 35 to 55 and may cause nipple discharge, which can be clear or bloody. While intraductal papillomas are benign, they can occasionally harbor atypical cells, which may slightly increase the risk of developing breast cancer in the future. Diagnosis is typically made through imaging studies and biopsy, and surgical removal is often recommended, especially if there is associated discharge or atypia. Ductectasia is another benign condition that affects the milk ducts, usually in women approaching menopause. It involves the widening and thickening of the ducts beneath the nipple, which can lead to a sticky greenish discharge, nipple inversion, and sometimes local tenderness or inflammation. Ductectasia is not cancerous and often resolves without treatment, though persistent symptoms may require minor surgical intervention. Less commonly, fat necrosis and lipomas can occur in the breast. Fat necrosis results from injury or trauma to the breast tissue, leading to the formation of firm, round lumps as the fat cells die and are replaced by scar tissue. Lipomas are soft, benign tumors composed of fatty tissue and are generally harmless. Both conditions can mimic the appearance of breast cancer on physical examination or imaging, so biopsy may be needed to confirm the diagnosis. While most breast conditions are benign, it is crucial to remain vigilant and seek medical attention for any new, persistent, or unusual breast changes. Early evaluation by a healthcare professional can help distinguish between benign and malignant conditions, ensuring timely and appropriate management. Regular breast self-examination, clinical exams, and recommended imaging studies such as mammography or ultrasound are key components of breast health maintenance. In summary, a wide range of benign breast conditions can cause lumps, pain, or other changes in the breast tissue. Cysts, fibroadenomas, fibrocystic changes, mastitis, and other non-cancerous disorders are common and often manageable with simple interventions or observation. Understanding these conditions can help reduce anxiety, promote self-awareness, and encourage proactive care. Nevertheless, any breast change that is new, persistent, or concerning should always be evaluated by a healthcare provider to ensure optimal breast health and peace of mind.